this assessment, I'm going to be assessing the T8, T9 segments. Begin by bisecting the base of the scapula. Let's be at T7. I'm going to palpate the T8 and T9, move back up one interspinous space. Alright, can I have you cross your arms? Okay, I'm going to bring the patient into flexion. As I bring the patient into flexion, I don't feel the joints opening up as they should. I feel some restriction, so I'll further assess that. Okay, I'm going to move slightly lateral to the spinous processes. T8 and T9, spine on T9. All right, can I have you cross your arms? And I'm going to check for rotation. And as I rotate the patient, I'm going to spring into that joint space in a lateral to medial direction. And I feel normal joint play. Move to the other side and check rotation on the right. Again, as I rotate them, I bring them, or spring in from the lateral to medial direction. And on this side, I do not feel the joints opening up as they should, or rotation to the right. Okay, so now I'm going to check lateral bending. And as I laterally bend the patient, I'm going to spring into that joint space, lateral to medial direction. Once again, I feel restriction. I don't feel normal end play. Check the lateral bending on the left side. Okay, so I feel that joint space open up. I feel normal in play on that side. Alright, well, where he will not rotate to the right, and there's restriction in the right lateral bending. This would make the listing a PRS, and to further assess it, I'm going to check the ribs or the associated rib pairs to make sure that they are not associated with this restriction. Alright, I'll begin by dissecting the base of the scapula. T7, come down to T8. Back up 2 interspinous spaces. Come out laterally 2 inches, and that puts me on the rib. Okay, I'm going to be checking for elevation and depression of the rib. Okay, for elevation, I'm going to be on the inferior aspect of the rib. Can I have you cross your arms? Actually, I'm going to switch my stance here. Okay, I'm on the inferior aspect of the rib. Okay, I'm going to bring the patient into flexion, rotation, and lateral bending, and I can feel normal elevation of the rib. Okay, now I'm going to check for depression, so I'm going to get on the superior aspect of the rib. I'm going to bring them into extension, rotation, and some lateral bending, and I feel normal depression in the rib. I need to check the other side. Once again, I'm at the base of the scapula. Bisect base. Okay. T7 and the T8 up 2 interspinous spaces. Move out laterally 2 inches. Okay, I'm now on the rib. I can have you cross your arms. Okay, once again, I'm going to check for elevation and depression. So for elevation, I'm going to flex the patient, rotate him and laterally bend, and I feel normal elevation of the rib. Okay, now for depression, I'm going to be on the superior aspect. Bring him into extension, rotation and lateral bending, and I feel normal depression of the rib. That's it.